Can everybody hear me okay? Awesome. So, wow, it's been 2 days of really awesome work and presentations, and it's nice to also be in between sandwich some other smoking topics that are also really important. I did my practicum in northern BC in the city of Prince George with an organization called WIN-BC, or Promotion of Wellness in Northern British Columbia. Their mandate and mission is to promote health and wellness and reduce chronic disease through healthy living and physical activity, also to build capacity of wellness through education, research, and community development. I was really lucky, and my practicum was also supported by the Health Authority Northern Health. And you can see on our really fuzzy friend, Spirit was he's actually one of the first health authority that has a mascot in preparation for the games. So here we go. So just a little bit more background and context to my practicum. I went up there to participate in a really awesome project that was developing a legacy for the Canada Winter Games. So legacy, what does that mean? I had to think about this a lot. Everybody was throwing the word around, and I was just really struggling, like legacy, okay, leaving something behind. So one of their goals, WIN-BC and Northern Health, was really to leave something behind, literally a document that we could pass on to future health authorities in preparing for such a big event like the Canada Winter Games. Did anybody watch the games up north or had anything to do with it in some capacity? Yes, cool. So Prince George is actually expecting about 15,000 people extra coming into the city, and it was a big deal for public health. And as of early 2012, plans started getting underway to get ready and be prepared to host such an awesome event. And also, we wanted to leverage the Canada Winter Games for health beyond actually preparing for an outbreak or something like that. So decided my project, so I had the whole legacy idea, and I was preparing and collecting data and information for that. I didn't have an office, I was running around town, but I also wanted to develop a policy summary and analysis of the actual 2015 smoke-free, tobacco-free policy that was initiated by WIN-BC, Northern Health, and a whole bunch of other collaborators. So we're just going to tap on the stats. A couple people have already mentioned this already, so I'm really grateful. Basically, in Canada, in 1965, smoking rates were almost at 50%, and they've decreased dramatically as a nation, but we really have to make sure, well, what's the health issue in northern BC? And so that is something that's still currently a problem. So the health service delivery area has been divided into 3 in that region. We've got Northern Interior, Northwest, and Northeast. And as you can see, the highlighted portion in red up top is at 23%. So we're lying at the second highest smoking rate in the province as of 2010. Unfortunately, I couldn't find more recent stats. And that includes the city of Prince George and the region. And we really wanted to focus on addressing this issue during the Canada Winter Games. So my methods, I cherry-picked and hand-searched. In that aspect, it was really awesome. I wanted to look at legislations and regulations that currently control tobacco and smoking on provincial, municipal, and federal jurisdictions. I also wanted to look at information on past smoking policies and sporting events. Because this was the Canada Games, I wanted to see what happened in 2010 during the Olympics. What about Sochi and that kind of stuff. So I wanted to incorporate what past history and games had done. And also, I just needed to get documents. I started my practicum in January, but a lot of the planning had already been going underway, and I was really just wanted to get caught up on the information and where the smoking policy was at that moment. So I looked at federal, provincial legislations and regulations, and municipal bylaws. I found the gap in the policy. I think it was Fair, the BA student, and I'm pretty sure it was her who also kind of mentioned that provincially and federally, they don't really incorporate the regulation of smoking in outdoor recreational grounds. It's really left up to the municipality to kind of cover that gap. And so that's what Prince George needed to address for the games especially. So sad news, there's a clear deficiency in provincial regulations for smoking and outdoor recreational areas. The good news is that this smoke-free policy that was happening during the Canada Winter Games is actually like a pilot, and currently right now they're going to be doing a new bylaw. So some games history really quickly. First free tobacco games was in Calgary in 1988. 2010 did also a smoke-free, and Sochi. So the policy itself was really simple. We just wanted to have smoke-free, tobacco-free. The goal was to educate people around secondhand smoke as well. And policy components included some of Quit Now resources, which I think Solomon had also included, signage, and also educating the population around secondhand smoke. And the target population was really everybody that came to a venue. So we were talking about athletes, coaches, spectators, and everybody who was gonna watch a sporting event. There was a whole bunch of different organizations involved. It really demonstrated an awesome way of collaborating and coming together. Each of these organizations put something else into the mix. When BC advocated a lot, we were really lucky to have the City of Prince George on board, and there was a proclamation that the Minister of Health actually attended early January. And in terms of policy development, I'm going to quickly run through these, but it was heavily collaborative. Stakeholder engagement was really key. We knew that the city and the community was ready to move forward, and logistics, well, that was pretty much me and the tobacco reduction team up at Northern Health that really just literally put up the signs at all of the venues, and it was really awesome. This is just an example on a ski hill at one of the venues at the Canada Winter Games. We put signs up everywhere, like everywhere. And some of the learnings had to do with, sorry about that, venues. So we saw that each venue hosted a different type of sport that hosted a different type of population that came. One of the highest smoking rates we saw was at the gold medal hockey game that was on the last event. And literally, like, people forgot about the 3-meter distance from the walkway of the arena, and people were smoking like almost in the entryway, and it was quite interesting to watch and a little bit unfortunate, but we also understood signage was going to be a little bit of a problem, and recommendations. We actually had one of our venue sites, because it wasn't initially done, create a bilingual version, and that's something that we needed to do for the future, is create a bilingual sign. That's something that we just dropped the ball on. We also wanted to find different ways of promoting the venue, the smoke-free policy rather. So we thought of like putting the symbol on tickets that were being sold. And we also wanted to make sure that the next time at the games, if there's going to be a smoke-free policy, that we were going to actually educate the volunteers. Canada Winter Games runs on volunteers. We're talking about 4,500 people that volunteer for the games, and that's a key place that education can happen for the smoke-free policy. So I did a quick analysis comparative why Red Deer versus the 2015 Canada Winter Games policy is that 2019 is going to be where the next Canada Winter Games are going to be hosted in Red Deer. So I wanted to see what their bylaw was like currently. The main gap was that ski hills, and they didn't include e-cigarettes, and the 2015 Canada Winter Games policy did, which was really awesome. The Canada Winter Games policy also included and acknowledged the traditional use of tobacco, which I found was really important. I think that should be moved forward, and also didn't even include designated smoking areas. So there was just nowhere where you could smoke, although some people did. So strengths, partnership and collaboration was huge. That's something that we really saw from the beginning. Prince George was a city that I had such an awesome experience in, and you really have to collaborate because the resources are different and they're limited. So you have almost no choice but to collaborate. We also just wanted to contribute to the legacy of information. We just wanted to leave something behind so that future health jurisdictions can move from this and move forward and take it to the next level. And of course, that's all knowledge translation. Challenges, well, collection of information was tough. I was just one person, but I was really lucky to work with the tobacco reduction team at Northern Health, who were really wonderful in providing with me like anything that I needed, from old documentations to meetings, and it was really wonderful. Navigating relationships is something that I really, really learned through this practicum. Working with the Canada Winter Games Host Society, the City of Prince George, Northern Health, and WinBC, everybody has their own agenda, and there's some overlap, but there's also some diverging goals as well. Timing of the policy was good, but it was quick. Implications for public health practice. So I think the main thing was that now with this bylaw that's going to be put in place hopefully in the future in the City of Prince George, Northern Health has something that they can rely on, something that they can build on, and it's hopefully it's going to be passed. Prince George, you know, I think somebody else said there's about 30 other communities in the province that has this bylaw, and it's going to be something that hopefully is going to be able to a seamless transition. And just an acknowledgement, my supervisor, wonderful Dr. Anne Poussette, Executive Director of WIN BC, and my practicum supervisor, Northern Health, for all the amazing resources that were put into my practicum. I was really, really thankful to have 4 wheels up there, especially during winter. And to first reader, Dr. Catherine Worthington, and second reader, Lynn Davis, and family and friends, of course. It would have not have been possible. Thank you.
Questions?
Thank you so much. What a wonderful presentation. I echo the driving in Prince George. I had to rent a minivan and shuffle around kids for the youth conference. It was just, yeah, not a fan. I was just wondering, it might apply to some of the other people who spoke about tobacco cessation. As like an ex-smoker who's trying to quit smoking, sitting and listening about smoking for the last hour, kind of makes me want to go outside, but did you guys ever consult smokers about what's the best way about their arena? Because I'm assuming alcoholic beverages were probably one of the big causes of why people weren't respecting the bylaws. And sitting here just reflecting on kind of the paradigm when we're dealing with people with different types of drug addiction, we would always go to them. And I think that's that parallel that someone brought up earlier is, are we fighting for like the free air, or are we fighting for the person with the addiction, or how are we viewing that lens of smoking?
Yeah.
And
Yeah, no, I think, unfortunately, when I entered into my practicum, the policy was already underway, so I don't know a lot of the hands-on history in terms of putting the policy together, and if they incorporated actual responses and integration of information from first-hand smokers. That I am not sure. I know that the Quit Now resources and things like that Northern Health does use is I'm sure incorporates that somewhere along the line. The one thing that I want to mention is the Canada Winter Games policy is also a little bit unique because it's focusing also on tobacco in sport, which is something that doesn't really come across in this presentation, but that Northern Health really wanted to try to attack as well, is things like chewing tobacco that in certain sports like hockey and baseball and softball, maybe not in the winter sport, but is also an issue. And I think that we try to do a little bit of everything, but definitely incorporating a little bit more information about firsthand knowledge of what smokers may go through would be definitely important in the future.
Any other questions? Okay. Well, if not, then thank you, Alex. Lynn Lynn had a question.
So if we ever wanted to develop a mascot for PHSP, would you help us?
I would. Totally, yeah. It's he was really great in terms of, just getting out there. That's a picture of me. I actually worked with the health promotion team outreaching and doing a lot of the messaging and stuff, so it was really fun. And I, Vancouver Island Health, get on the bandwagon and make a little fuzzy, cute guy, because it really helped. It was great, yeah.
A rabbit.
Oh, cool.
It's a whale or something.
Nice. No, Spirit the caribou does not smoke. No.
All right, well, thank you so much, Alex.
you.
Thank you for being last.